Hello. You hear that music?
Yep. So, are you good? You need me because this is Loris's. Hi, Dr. Johnson.
Hey there. How are you?
I'm well.
What's up, Alex?
Yes, sir.
So you gonna help to moderate? No,
I got this.
This is Loris's. You're gonna do the introduction.
Well, actually, no. It was actually I was supposed to be moderator for this.
Oh, are you? Okay, I'm sorry. I thought Loris just told me he was.
No. I was supposed to be moderator for this one.
Okay.
According to the runner show.
I'm your admin.
I know this. So I looked at the schedule.
Can you help me out too? I love admin people because I hate paperwork.
Okay, so basically, I think we got one more we're waiting on. How you doing, Kimberly?
Good morning. Good morning. How is everyone?
Carlos Smith to join in, and then basically it's 10 minutes of Alex is moderating. So Alex, did everyone have any? You already got your questions that you want to ask, or I know Alex is the moderator, so he may be asking some questions to you guys too. I'm gonna go off film once we start. So I'm gonna I
got a couple of questions for Kimberly.
Sure.
And I have a couple of questions for, of course, Dr. Johnson. And we're gonna try to make this happen.
Yeah. And so I would suggest, Alex, from 12:20 to 12:30, just have a 10-minute Q&A, and then it'll be over to 12:30.
Absolutely. Hey, Kimberly.
Yes.
I was trying to find some information for you on LinkedIn, and apparently somebody else has your name out there too.
Oh, really?
Oh, yeah.
Two of us.
That's an odd last name.
Yeah.
Yeah, it's different. Because according to this, you're according to the Kimberly that I looked at, as board member of the Dentistry College of Medicine. Is that right or no?
Yep. I'm on the Illinois Board of Dentistry.
I got that right then. Yes. I got you. I got you now.
Yeah, and I'm also a faculty member at Advocate Illinois Masonic at the Department of Dentistry.
Faculty at what?
And then at Chicago Medical School as well. And I have a colleague that is going to join, Dr. Ryan Turner. We were going to present together. I know he had an emergency patient, so he should be logging on soon.
Well, the funny thing about it is, I was asking. I said, "Well, wait, I don't have any information on Brother Turner here," because I was just trying to look him up on LinkedIn too.
Yeah.
And I'm like, I don't know if it was somebody that was a school student, and I said, "No, he can't be a student."
Well, he recently graduated from Howard. He's a resident at Illinois.
That was him then.
Okay.
Yep.
So Alex, with that said, only 5 people can be in at the same time. So I'm going to have to leave because we still have who Kimberly just announced. And then we also have Carlos Smith. So that would be 5. Only 5 people can be on the screen.
Okay. So what's going to happen is whenever he chimes in, I'll have him, briefly.
No, we won't be able to chime in because I'll be until Carlos.
Okay.
Whoever jumps on first, if Carlos jumps on, then I'll jump off. Oh, he said he's trying to get in.
Who's Carlos?
Yeah, let me just send him. Send him an email. A chat.
Okay.
Click on the session.
And I'm doing the same with Ryan right now. He just texted me to ask how to get in.
And then they have to hit share audio and video. That's what they're missing.
Okay. Yeah, that's what I told him.
And
yes. So Kimberly, let them know. First come, first serve.
No, I'm gonna jump off. So you can have everybody in the session.
All right. So let me be real brief and let you know that first of all, let me welcome everybody to the Preventive Specialty Care session. Of course, I will be your moderator. Yours truly, Alex Felton, 100 Black Men of Chicago member and Health and Wellness Committee member as well for this segment. So what I'll do is, since we have the lady Kimberly, you will go first in this order, and we will have Carlos go second, and Ansel Johnson will go last. And I just want to be cognizant of the time because I do not want to cut anybody off. All righty.
Ryan's here.
So we'll try to save our. How you doing, Ryan?
I'm doing well. How you
welcome,
doing?
Welcome. My name is Alex Felton, and what we'll do is we'll save our questions for the end. I'll try my best to ask you very positive questions and address any that may come over as a result of any of the people who are viewing this particular session. Okay.
Sounds good.
All right. So I think we are at time at this particular time. So we'll start with. Kimberly Fasula. So can you tell us a little bit about yourself and what you're going to speak to?
Sure. So my name is Kim Fasula. I am a dental hygienist by training. I have, worked a lifetime in dentistry, teaching dental students, currently teaching both dental and medical, done some clinical research, ran a clinical trial. My PhD work is in interprofessional education. So bringing, all the healthcare professions together. So happy to be here today.
Happy to have you here. So let's speak to what you love to talk about.
All right. And I would also like to introduce my colleague, Dr. Ryan Turner. Ryan, did you want to go ahead and give a brief intro?
Yeah, a brief intro about myself. I'm Dr. Ryan Turner. I'm from Chicago, Illinois. Went to Howard University for both my undergraduate education as well as my dental school education. It's just wonderful to be here this morning. So thank you for having me.
Thank you for being here. All right. So let's talk about what you guys would like to share with the audience today.
Sure. Are we allowed to do a screen share?
I would think that you might be able to. I hope you can. I know that was pre, but let's see what you can do. Do you have the ability to do it?
Yep, I'm trying to right now. It doesn't look like it's allowing anything. So for the sake of time, I guess I could just go ahead and get started.
Should be able to, the little screen on the bottom.
Yeah, I tried.
The second to the left.
It's not finding
to the right.
Yeah, I selected and I tried to find the window, but nothing's popping up.
Oh, I'm sorry to hear that.
Only Chrome tabs, but that's okay.
Don't you love technology?
I do, of course.
Go ahead, Kimberly. You got this.
All right. So, what we wanted to talk about today is basically oral health, and some of the things we look at are some oral health statistics, population disparities, how oral health relates to the body, and really focus on some prevention methods. So when we look at national statistics, we look at some data and we pull out things about dental decay. It's still the most common chronic disease for children. In terms of gum disease, about 50% of adults suffer from some form of gum disease. When we increase the age, if you look at someone that's over the age of 65, that percentage increases to about 70%. Oral cancers, also a big concern. Over 54,000 cases of oral cancers are diagnosed annually in the U.S. And when we look at, we recognize these high numbers of cases, Black men experience the lowest 5-year survival rate of oral and throat cancers. So, we look at advancements, despite advancements with prevention in the U.S. Over the past 4 decades, comparatively low rates of improvement have been seen in, among different racial and ethnic minority groups. The fact that Black populations have consistently experienced higher levels of untreated tooth decay, periodontal disease, we're looking at some, additional evidence of inequities. So what do we attribute this to? We look at things like access to care, affordable care, inadequate coverage of insurance. So these things just scratch the surface of why we want to address not only issues with access to care, but also really stressing prevention measures. So I always talk about, with a strong background in public health, I always talk about a case that was completely preventable. Many people know about this back in 2007. Little boy by the name of Diamante Driver died basically from tooth decay. So he had an abscess. The infection traveled to his brain, and he subsequently died from, a bacterial infection. What we really focus on, this was an $80 tooth extraction. So this could have been prevented. $1 fluoride application could have helped save his life. So we really want to think about prevention measures. And this is really sad because this wasn't in a third world country. This happened in the shadows of our nation's capital. So it really kind of puts things into perspective. So we ask ourselves, why is oral health so important? We have to think about that mouth and body connection. Oral health is associated with your overall health. It impacts your ability to eat, to speak. We've seen issues with mental health, self-esteem, and I have a patient burned in my brain. It was our custodian at the dental school's child, and he brought his child in because they were so self-conscious about their mouth and smile that they wouldn't speak without their hand in front of their mouth. And he said it was really impacting their, time at school and things like that. So it really can affect the quality of life. So when we look at, again, your mouth talks to your body talks to your mouth. So what sort of things do we look at? How gum disease is associated with heart disease, diabetes, poor healing with diabetics, bacteria that in your mouth enters your bloodstream, associated with strokes. We look at Alzheimer's and tooth loss. There are so many studies out there. So pregnancy, it's really important. Oral health is really important during pregnancy. Really strong links to heart disease. Prior to COVID, we know heart disease was the leading cause of death in the US. Lifestyle changes, they say 80 to 90% can be prevented through lifestyle changes in terms of heart disease. So we know periodontal disease has this direct link to artery inflammation, and every tooth loss increases the risk of coronary disease. So keeping your mouth cleaner and your periodontal health up to speed has reduced the number of hospitalization admissions. And just looking at how gum disease, is associated with the rest of the mouth. Dr. Turner, I don't know if you want to take it from here. Do you?
Yeah, I can.
Sure.
Going off what Kim says, it's very important, the connection between the oral cavity and the rest of the body. Speaking about the diabetes in general, diabetes increases the risk for oral diseases. So that poor wound healing or poor healing that Kim mentioned previously is a relation to diabetes and the oral health. 1 in 5 cases of total tooth loss is linked to diabetes. So we also often see that connection as well. Research has shown that gum disease can worsen if your blood sugar is not under control. So uncontrolled diabetics, and I've experienced this actually in a clinical setting, some uncontrolled diabetics are experiencing a hard time of maintaining adequate oral health, and we can see the correlation between their whole body and how they're healing. In regards to COVID-19 and the oral health, the pandemic, once, as Kim mentioned before the COVID, heart disease was the leading killer in this country. But since the beginning of 2020, more than half of adults in the U.S. say they have put off getting oral care, going to the dentist due to the pandemic, COVID-19. So that's something that, as a clinician today, that we have to take into account as far as people have delayed this treatment. And if you can imagine delaying treatment, more issues can arise. So it's something that's a battle every day with the populations that we treat, that we have to help, catch up to speed the time that we lost due to COVID-19. Regards to medications and oral health, a lot of people do take medications. I have a lot of patients that take medications, and there's some manifestations that take place due to the medications these patients take. You can experience dry mouth, which is very common. ulcers, overgrown growth of the gums, and also taste alterations. So medications do play a vital role in how people maintain a certain lifestyle and how they experience every day. Oral health and diet. So you're often told to, reduce the amount of sugars and sweets we intake. I know that's hard for some of us. Like myself, I am dense and I do love my sweets, but we have to be cognizant and aware of what we do intake in the body, because that does play a vital role in our oral health. So we want to avoid sweets and sugars. We want to make sure that we clean our teeth at least twice a day, at least floss once a day. We want to eat leafy greens, vegetables, vitamins K2, nuts, and the phosphorus in our diets. We also want to make sure that with our teeth that we stay away from things that stain in our teeth, as well as coffee and teas. And when we do drink these beverages, we want to make sure that we clean our teeth. We want to make sure that we do clean our teeth prior to and after we have these beverages, because we don't want the buildup to stay present in the oral cavity. So some of the reasons, going back to why people kind of push off going to the dentist, there's a couple of different reasons. COVID-19 is one, but it's also the simple reason some people may feel afraid to go to the dentist, or they don't have the time due to work or school, or just what's going on in their everyday life, and we see that as an issue. Also, the cost, the expense of getting oral care can hinder some people going to getting care at the dental office. So statistically, over all ages, we see that cost is a big factor as far as people preventing them to go to the dentist and receive care. And it's something that is alarming. I would say in my time of being a clinician, I have family members and friends, even some patients I treat every day that just can't afford or don't want to, spend their money on getting oral care. They kind of push it to the side, but we have to take into account that oral care, like we mentioned before, is a major link to the rest of our overall health. So this is just a constant encouragement to make that effort to get oral care.
Outstanding. Hey, what I'm going to ask you to do for the speakers, whenever you're speaking, hit it twice so that you can basically be on top, so you can get the full screen when you get the opportunity going forward.
Okay. Hit what button twice?
There's something on there to the right that you can hit that will enlarge the screen, and you'll be on top of everybody else.
Full screen right here?
Let's see. Full screen.
Yeah.
Hit a little square in the bottom right hand corner.
Oh, okay.
Yes.
Was that a change?
Just tap on your picture.
Oh.
Tap on your picture, and you'll be enlarged.
Okay.
Don't sweat it if you're going through. You know how technology is in this case. I wanted to be cognizant of everybody's time in this regard. I mean, I think what you have is so informational. And one of the questions I had directly for you was sodium peroxide. Is that an asset for oral health?
I actually encourage. It's so funny. Growing up, my mom always told me to use sodium peroxide, right, to rinse. Going through education and learning about it is very helpful. That you can use as a mouth rinse to help keep your oral cavity clean. So I encourage it for some people who don't have a mouthwash. I also encourage mouthwashes in general. But if you just have peroxide at home, it's a great use. About 30 seconds rinse and wash out.
Outstanding. I want you guys to hang tight, because I might have one more super question for you at the end.
Sure.
So hang in there. What I'm going to do at this point is I'm going to ask Dr. Smith. Are you available, Dr. Smith? Dr. Smith, are you there? Dr. Smith? I see you. I just can't tell if you're available. You're muted, Dr. Smith. Unmute yourself. You're still muted. Okay. Dr. Smith is still muted. What I'm going to do is, Dr. Smith, we're going to come to you in the end. What we're going to do at this particular time is we're going to go on to Dr. Johnson at this particular point. I'd like to just give an overview of Dr. Johnson. He is the founder and clinical director for Vision Salon Eye Care Associates in Blue Island. He received his bachelor's degree in biology from Illinois Wesleyan University in Bloomingdale, Illinois, and a doctorate degree from the New England College of Optometry in Boston, Massachusetts. He's completed a postgraduate certificate from the Optometry Executive Program at the Wharton School of Business at the University of Pennsylvania, and he is currently an adjunct professor at 5 optometry school programs, and his office serves as an externship site for their students. He is currently serving as a staff for the Advocate Trinity Hospital in Chicago, Illinois. He's the only eye care office in Illinois with a nationally certified diabetes education program. Dr. Johnson is certified diabetes prevention lifestyle coach by the CDC Diabetes Prevention Program. He is committed to making an impact in eye care and health care in the community. And without further ado, I present to you Dr. Ansel Johnson.
Wow, thank you very much, Alex. Really appreciate the introduction. And I'm going to see if I can follow instructions and make my screen a little bit larger.
Just tap on your picture and it should enlarge it.
Correct.
Typically, I would say there's something in the bottom right-hand corner with a little square.
Yeah, I see it. I'm enlarged on my own screen. Do you see that?
Okay, you go ahead and do that thing.
All right. Let me see if I can share my screen. I know that kind of failed Kimberly, and now it's kind of X'd out.
So you have the screen with the is X'd out. Can you tap on it?
Shoot, shucky ducky quack quack. Okay, where do I? Man, everything was just set.
Don't you love technology?
Man,
it's a wonderful piece. Just when you have it all laid out, right?
So somehow my pictures failed. I don't see that.
That's okay. You're great at what you do. Go for it.
Here we go. Still can't share. All right. Well, I got to pull up my presentation somewhere else. And my name is Dr. Ansel Johnson. I'm the clinical director of Vision Salon Eye Care Associates in Blue Island, Illinois. And just going to kind of go through some things here. Someone just save changes. And I'm going to try this one more time. To see if I can share the screen. Because there's some really good information on here, and I really want to.
And also, just for the sake of time, in any event that you can't, basically in the chat, place that information for a link so we can acquire that later.
Okay. Yeah, I can supply the PowerPoint to anybody that wants to wear it. But first of all, thank you, Alex, for the wonderful introduction. I really appreciate it. Title of my presentation is basically Living with Diabetes with Your Best Vision. So really it's an honor and a privilege to be here with 100 Black men. I really appreciate the introduction. I always get very excited about being able to share with the public on a grassroots level things about eye care and how it relates to everything else. And eye care, I always tell people in our office, we're just more than just an eyeglass place, because just like dentistry, because we're kind of parallel professions, everything is connected. In 2020, we celebrated, 30 years of being in business since 1990. And we are really dedicated to being a part of the community in so many different levels and different ways. In 2018, I was featured in a Southland Optometrist that focuses on fighting diabetes because of the work we've been doing with our diabetes education program. We are, as Mr. Felton said, we are the only eye care facility in the state of Illinois, and there's only 2 in the United States that have their own certified diabetes education program. Why? Because we see a lot of people that are living with diabetes, and so many times I would see people that had never talked to a diabetes educator, had never spoken to a registered dietitian, that basically have not been armed with the information and the tools to help control their diabetes. They basically depend on the physician to give them medication. And in most cases, if you just depend on medications without lifestyle changes, you are not going to be able to well manage your diabetes over the course of a lifetime, which is a chronic disease.
Speaker, okay.
And let's talk about healthcare disparities. In healthcare disparities, compared to white adults, the risk of having a diabetes diagnosis is 77% higher amongst African Americans.
Because I see him on here.
We also have lower rates of receiving their annual diabetic eye exam. And that's the minimum standard of care. Although as we go on, just having your eyes dilated, that's where we put drops in the eyes that make the pupils larger.
Okay, I'll call.
So that the doctor can get a better view of the back of the eyes. That is not, it's fast becoming an inadequate care because there's so much technology that's out there that can detect very minute changes in the blood flow and other areas of the back of the eye before we can physically see changes in the back of the eyes with our own eyes. Now, also for African Americans, there are disparities in outcomes and the gaps attributed to differences in the quality of care that's received. And there's a number of reasons for that, but the studies have shown time and time again that Black people do better with Black doctors. That's indisputable. And only 5% of doctors in the United States are African American, and less than 2% of practicing optometrists are African American. Just 2%. So we have so many generations of people that have never seen a Black optometrist. In the Chicago area, there are only 4 of us that have their own independent practices. So that's a problem in terms of access to care to someone that looks like you. I want to talk a little bit about, we're talking about diabetes because November is Diabetes Awareness Month. However, one thing that is often skirted over is prediabetes. And there's a really big push to deal with people that are borderline or labeled as prediabetes. So,
hey, Doc Smith, this is Alex Felton. How are you?
And 1 in 5 adults, 1 in 5 adolescents and 1 in 4 adults are now living with prediabetes.
Okay.
1 in 3 adults
hang in there,
have
bud.
prediabetes.
Don't hang
There's 1 in 3 adults in the United States. And so many times our people are told, well, you have a little sugar. And we kind of skirt it off and push it off and don't really take it seriously. And I'm a walking, talking, living example of that. I am a healthcare provider, but yet I am living day to day, making those decisions every day, living with type 2 diabetes. So I always share that with my patients. I'm not talking from an ivory tower situation. I'm talking about my day to day life situations and how I kind of ignored prediabetes, and that generated to a healthcare crisis. And now I'm living with diabetes. So when you say, what does it mean to have a little sugar? It's really just the tip of the iceberg. And then also, in addition to sugar, is it really just about sugar? No, it's not just about sugar. It's about other aspects of your life. In terms of diet is generally 80% of it. Portion control, the mix of the foods that you eat, meal planning, meal prep, as well as physical activity, as well as mentally handling your situation, because there's a high level of mental illness, or shall we say depression more specifically, in people that are living with diabetes, because it's so overwhelming. You know, You got to go to the doctor on a regular basis. Got to see the specialist. Got to see the foot doctor. Got to see your dentist. Got to see your eye doctor. Got to handle your medications. Got to measure your blood sugar. Got to watch what you eat. So a lot of times it's very overwhelming for many individuals. So what are our greatest fears if you're living with diabetes? And a lot of times people fear sticking their finger all the time to try to check their blood sugars, or sticking themselves in other places in the abdomen, and leg, and arm to inject insulin or other medications. There's a big fear of needles in everybody. Now for men, this is a 100 Black Men program. And so in men, we need to think about diabetes is a major cause of erectile dysfunction. So, and I think we need to really bring that to the forefront, because how our penises handle their business can be the canary in the mine shaft for our overall health, because that organ is innervated by very tiny, tiny blood vessels that are delicate. And those same type of tiny blood vessels exist in the eye. But the major fear in terms of having or living with diabetes, getting that diagnosis, is losing sight. Diabetes is the number one cause of blindness and reduced vision in adults in this country. So loss of vision, although some brothers might say, well, if Stevie Wonder can have children, maybe I can too. So some folks, it might be a toss-up between erectile dysfunction or blindness. But overall, if we look at studies, blindness is the overwhelming fear factor when you get that diagnosis. So along with blindness, there's kidney disease. And one thing you got to notice is that there are a whole lot of kidney dialysis centers that are popping up in our neighborhoods. And why? Because our community is not handling living with diabetes that well. You have nerve damage, you have amputations, and the number one causes of death, top cause of death when you're living with diabetes is not blindness or kidney disease, because you can go on dialysis, is cardiovascular, stroke, heart attack, those sudden causes of death, stroke and heart attacks, because diabetes, wherever the blood flows, diabetes can affect that. And I had a slide here that showed the basic anatomy of the eye. And many people think that the eye as being this solid organ, when it is a very complex organ that allows us to see. You have the lens of the eye towards the front, right behind the color part of pupil. You have the clear, the eye is actually hollow. It's filled with the jelly-like substance we call the vitreous, and that jelly is clear. And then it actually helps enhance the light passing through to the very back tissues of the eye that are nerve tissues in there, and have tiny blood vessels flowing throughout all of those little nerve tissues in the back. That is very, very sensitive tissue, but it collects the light and allows us to see, transmits to the back of the eyes, to the brain, and that's how we see with electrical signals. So what are the standards of eye care for those living with diabetes? Well, again, as I mentioned earlier, the standard is having your eyes dilated at least once a year, where the doctor looks in, puts drops in that makes the pupils larger so we can see in the back of the eyes. Now, again, in my opinion, in our office, we practice a much higher level of care, because there are so many technologies and imaging devices that can allow us to see those changes literally years before there's any effect to your vision. So what happens to us, especially as men, we wait till there's a vision problem that occurs, and that sends us into the eye doctor's office. And that's kind of like waiting till your oil light comes on to change the oil in your car. Another factor is that most times when a type 2 diabetes diagnosis is made, it's usually 9 to 12 years after that diagnosis could have been made with some of the early detection methods. So in our office, and in most eye doctors' offices, one of the first signs that people send us into the office is blurry vision. And blurred vision from diabetes, living with diabetes, pre-diabetes, can have several different causes that causes that vision to be blurred, from dry eye, which is more common, to cataracts, which is more common, to diabetic retinopathy, bleeding or swelling and scarring in the back of the eyes. So again, as I just mentioned, the main threats to sight with diabetes is, one, glaucoma. Glaucoma is an eye disease that Usually you can have elevated or even normal eye pressures in the eye, but whatever pressure it is, it slowly causes damage to the nerve that connects the eyeball to the brain. And people gradually lose their side vision or peripheral vision until they have tunnel vision. The clear vision straight ahead is the last to go. So I have a number of patients with advanced glaucoma that have close to 20/20, if not 20/20 vision, but they have no side vision. And so that can be a limiting factor in your ability to drive. You can lose your license, your driver's license, because you don't have enough side vision to drive safely. The second is cataracts. Cataracts is a clouding of the lens inside the eye, right behind the pupil. And that lens gets cloudier more quickly and generally at a younger age because of the fluctuating blood sugar levels in the body that causes that lens to cloud. And the last, which is generally can be most devastating and happen all of a sudden, is diabetic retinopathy. And diabetic retinopathy basically are changes in the blood vessels in the back of the eyes that can cause leaking, scarring, and swelling of the tissues. And these things can happen quite in advanced nature without affecting your vision. Then what happens, they get a broken blood vessel that bleeds into the center part of the eye or causes swelling in the most sensitive part of the clearest vision. And people feel that their vision is suddenly gone, which again is hard to treat and very devastating. Now, in terms of some stats on diabetes, almost 35 million people have diabetes, which is about 1 out of every 10 people in the US. And 1 in 5 of those individuals do not know that they are living with diabetes. And then when we talk about,
I know you have a lot. I know you can go on forever because you're just phenomenal at what you do. But I'm going to ask for the sake of time. Let's move that on. And then any additional information, please put that in the chat, because I mean there's a wealth of information that everyone would love to hear from you. So 1 more minute, and then we have to get to Dr. Carlos Smith.
Not a problem. All right. And then so basically diabetes is very common, chronic, and controllable. And so there are some risk factors that we have to be mindful of: being overweight, family history, your physical activity, and just being over 45. And so we as men, why is it important to take care of yourself? Why is it important to have good vision? Basically because we are the leaders of our families, and our families should come first. We take the beating. We go out there in the world to provide and protect. And so we have to make sure that we're taken care of. And sometimes we forget about those little small things. It's not a small thing in itself. So with that being said, I want to thank you again for the opportunity of sharing some things about diabetes, how it affects the eyes. And there are some specific strategies that we all can have and be given and be taught to take care of ourselves and handle our diabetes. So with that, I want to wish everyone to be well, to see well, and be blessed. So I turn it back over to Mr. Felton. Thank you.
Thank you, Dr. Johnson. And again, put some of that information in the chat so that people will be welcome to your vital information. All right, thank you. Dr. Carlos Smith, I'm going to put you on speaker here so that you can basically convey and let me know. Are you there?
Yeah, can you hear me?
Can you guys hear him? Can you guys hear him?
Yep.
Okay, go ahead, Dr. Smith.
All right, thank you very much. Having some technical difficulties here, but I think we're going to get this done. First of all, I'm glad to be here part of this expo, and thank you for Dr. McGee for inviting me to this expo.
I think we
Can
lost.
you guys hear him? Can you guys hear him?
No, we just lost the sound.
Can you hear him now? Dr. Smith?
Yes.
Can you guys hear him now? Okay, go for it, Dr. Smith.
All right. So I'm practicing cardiac physician in Chicago, and I've been practicing over 23 years in Chicago, and my specialty is diabetic foot care. And so we're going to talk about why your teeth matter. of amputations begin with foot ulcerations. In the United States, about 108,000 adults have foot issues leading to amputation. And with that said, 5 out of 1,000 people in the country is living with diabetes. And because of diabetes and the effects of the amputation, we noticed that 60% of non-traumatic amputation in the United States are people with diabetes. Now, with that said, African Americans are 1.4 to 2.3 times more likely to get diabetes than whites. And African Americans has a higher incidence of diabetic complication as well as a high incidence of mortality rate. But one of the good things about educating our people is not all gloom and doom. We have found in the last 20 to 25 years that foot care and foot care education and the amputation rate has gone down about 50% in the past 25 years. What are some of the complications of diabetes that can affect the feet? One, we have diabetic neuropathy, as well as peripheral artery disease. Of course, diabetic neuropathy is a disease of decrease in sensation in your feet and ankle. This is due to the common complications of increased blood sugars that affect the nerves in the legs and the feet. Diabetic neuropathy symptoms include numbness, reduced pain, temperature changes, tingling, burning sensation, cramping, increased sensitivity to touch, loss of balance, and joint issues. One of the first things I ask all my diabetic patients when they come to the office, how's your blood sugar? And they come in saying, it's okay, but I've been having this tingling. It's probably because the blood sugar is not controlled, or the A1Cs are not in the normal levels that it should be. The other complication of diabetes that affects the feet is the peripheral artery disease. And here that we find a lot of patients present with cramping of the legs, skin color changes, numbness, weak pulses or no pulses in the feet or leg, and coldness to the lower extremity and the foot. A lot of patients will relate to me that they do have to wear socks at night because their feet are cold. And that's just one of the complications of the diabetes that affecting the foot with the circulation. And one of the main things I do look at the feet is hair loss. Are there any digital hair growth going on in the shiny or atrophy of the feet? That gives you some indication of if there is some artery disease going on. Common diabetic foot issues or problems, of course, is the diabetic foot ulcer. Because of the neuropathy, and these patients can't feel the pressure on those bony eminence, which can lead to callus formation and also leads on to infections. Foot deformity is a big complication where we see hamatoes, bunion deformities, and patients wonder why the muscle weakness is in their feet and they kind of contract the digits. Diabetic foot pain, as we talked about. Another thing is we find an increase in the dermatology of the foot. It's ingrown toenails because of the thickness of the skin, which causes fungus, and the nails start to press on the sides of the nail borders and cause ingrown toenails. Corns and calluses is also a common diabetic foot issue. As I mentioned, fungal infections, especially athlete's foot, where you have that dry, cracking skin. And many people just think it's just dry skin, but it's probably a fungal infection that's going on there. And also patients may have increased sweating of their feet. How do we avoid foot problems? Well, the main thing is to control the blood sugars. When we always ask the patient what is their hemoglobin A1C, because a lot of patients will come in and kind of do the due diligence. Oh, my blood sugar was one good yesterday because I didn't eat anything, but we want to look at the 3-month blood work of the A1C to see how what the levels are. Another way to avoid foot problems is strict foot care. Daily examination of the feet. If you can't have someone, if you can't look at your feet yourself, get a mirror or have someone look at your feet for you. And we also recommend quarterly foot exams by the proposed physician. One of the things that Medicare has provided is that you do allow routine or diabetic foot visits every 2 months or so. And the last thing is proper footwear, proper shoes, not the nice little pointy shoes and that we like to wear, heels of that nature. One thing also that advise my patients to do is to go in the mid-afternoon to get the buy the shoes, because that's probably when they fit is going to be the largest on the swelling. So we want to do all we can to prevent complications, which leads to amputations, ulcerations and amputations. As Dr. Johnson talked about.
Hey, Alex.
Yes.
Yeah. Hey, Dr. Smith, can you pause for 1 second?
Dr. Smith?
Yeah, I got a few requests that the audio is not working well. So Dr. Smith, did you on your computer, are you able to unmute yourself? Just click, yep.
You hear me now?
Yep. Yes. Whatever you just did.
Can you hear me? Yes.
Yeah, turn up the volume a little bit. Now I'm gonna turn Alex on mute and we should be good to go. So turn your volume setting up on your computer and you should be good to go.
Okay, can you hear me now?
Yes, much better.
Yes.
Okay. All right.
Yeah.
Thanks, Eric.
All right. So we're gonna run through that again, or are we okay?
No, actually, we won't for the sake of time.
We got,
how much time do we have,
if
Eric?
your session goes an extra 5 minutes, we're good because the last session doesn't start until 12:45.
Go for it.
Central.
Okay.
And then I have additional questions for you guys too, so we can squeeze that in too. Okay.
Okay. All right. Once again, this is I'm Dr. Smith, Carlos Smith. I'm in Chicago. I'm the CEO and medical director of Smith Centers for Foot and Ankle Care in Chicago. Been in practice there for over 23 years. I'm honored to be here with the 100 Black Men Expo. And thank Dr. McGee once again for the invite. I'm unable to attach my presentation, so I'm going to go through it as the others have done. Why your feet matters. And what we talked about is that 80% of the amputation begins with foot ulcerations. In the United States, 108 adults had foot issues leading to amputations. 5 out of 1,000 people live with diabetes. 60% of the non-traumatic amputations in the United States are on people with diabetes. African Americans is 1.4 to 2.3 times more likely to get diabetes than compared to whites. And we have African Americans have a higher risk of complications and mortality rate. But once again, not all is gloom and doom. With the increase of education of foot care, education of foot care, amputation rates has decreased about 50% in the past 20 to 25 years. What are some of the complications that lead to amputations and ulcerations of the foot? Is diabetic neuropathy and peripheral artery disease. Diabetic neuropathy, as we all know, is a decrease in sensation in your feet and ankle. This is due to the complications that affects the nerves in your feet and your legs. Diabetic neuropathy symptoms include numbness, reduced pain, reduced temperature, burning sensation, cramps, sensitivity to touch, loss of balance, and joint issues. The second issue that causes problems is peripheral arterial disease. Here, patients usually complain of cramping, skin color changes, leg numbness, weak or no pulses, coldness to the lower leg, and loss of hair growth on the feet. We also noticed with patients with peripheral disease, some thin, shiny, atrophic skin, which can lead to poor oxygen to the area which allow the foot to heal. Common diabetic foot problems includes diabetic foot ulcers, hammer toes, foot swelling, bunions, diabetic foot pain, ingrown toenails, calluses, blisters, fungal infections, dry feet, and excessive sweating. How to avoid foot problems, control your diabetes, as we talked about, and strict foot care, daily foot exams. We want patients to look at their feet on a daily basis, check their shoes out, make sure nothing has fallen into the shoes or that nature, and annual to quarterly foot examinations. And the last thing we want patients to do is wear proper footwear, and also diabetic socks to prevent swelling, to help with the swelling, to help with cramping. Don't want the pointy shoes and things of that nature. So nice, comfortable shoes. And like I said, I like to advise my patients to buy their shoes probably mid-afternoon. That's when the feet are probably the most swollen, and therefore they have the proper fit in their shoes. So I know we had a lot of technical issues, but I'm going to go ahead and hand it back over to Alex, and we can answer some questions.
First of all, I want to thank each and every one of the speakers today. All these doctors, you guys are phenomenal. I've learned quite a bit because my body's breaking down, but I need to be built up. And with that knowledge that you guys provided me, I feel strong. So I had a couple of questions that I wanted to ask each and every one of you, because I think that you guys are all profound. And these are some of the questions that I think that the typical patient would ask. The first question is going to be directed towards Kimberly and Dr. Ryan, respectively. How does dental hygiene affect one's overall health?
I could take that if you want. So the bacteria that's found in the mouth enters the bloodstream and can cause various systemic breakdowns. So reducing the bacteria level in the mouth is really important. We talk about, brushing, flossing, mouth rinsing, keeping your mouth moist. Sugarless chewing gum is good because it helps promote saliva. So if you're someone that has a drier mouth or on medications, just as long as you don't have a lot of like joint pain, chewing sugarless gum will be very helpful. Dr. Turner, did you want to add anything?
Yeah, I would just add that just having a good routine for oral hygiene can prevent a lot of problems. It's often found that the first manifestations for many diseases you can find in the mouth first. So keeping the oral hygiene up can prevent some of these manifestations taking place.
Outstanding. Dr. Fasula, Dr. Turner, you are both outstanding, and thank you very much for participating today. And again, please throw a link in there in the chat so these phenomenal patrons of this session can, contribute or ask you more questions, because I know they got a lot more.
Absolutely.
All right,
thank you for inviting us.
Thank you for having us. Thank you.
Thank you. The next question is going to be directed towards Dr. Johnson. Dr. Johnson, can you hear me? Can you hear me, Dr. Johnson? You're on mute, sir.
Sorry.
You're on mute.
Yeah, I can hear you now. Yep.
All right. So the question of the day: what can you expect from a diabetic eye exam?
In our office, and everybody does things a little bit differently, but in our office, again, we put drops in the eyes to make the pupils larger so we can physically see all the tissues in the back of the eyes. But we have some amazing technology that actually allows us to look at the blood flow in the very delicate parts of the back of the eye. And sometimes we'll see very slight changes in those, and this individual might have been diagnosed as borderline or early diabetes before there's any kind of vision loss. Early changes from diabetes, again, even pre-diabetes, can cause some issues with what we call contrast sensitivity in your night vision. So we can also do tests of your night vision, And we can also do a test of your color vision. And these changes are very, very subtle that you might not notice. So basically, the blood vessel scan in the back of the eye are very basic things that we do.
Outstanding. Thank you, Dr. Johnson. And of course, Dr. Smith, are you there?
Yes, can you hear me?
Yes, I can hear you well.
Okay.
This question is, how does podiatric health impact one's overall health?
Well, once again, with podiatric medicine, with foot healthcare, it helps. One of the things is that patients, if they don't have their proper foot care, they're unable to exercise, do what they need to do to get their blood sugars down. So we try to assist the patients with their feet and have them have good foot care, so they can do the other things such as exercise to help keep their blood sugars under control.
The reason why I did ask you these simple questions is because these are the things that patients never ask. They just come and do their thing and go about their business. But I thought that was pertinent for any of the individuals that are on this particular session to address something as general, simple as that. But I want to thank you on behalf of the 100 Black Men for your participation today. We know that you guys are real busy and you have other things to do. You guys are thoroughly respected. Dr. Fasula, Dr. Turner, Dr. Smith, and of course, Dr. Johnson. And I want to thank you very much for your participation. And you know what? Come on back and see us next year, okay?
Will do.
All right, so basically,
invitation.
thank you. And you welcome our guys to stay on and basically go into the various sessions and stages and expos and things of that nature as well. And again, leave your pertinent information in the chat so that we can, chime in and contact you guys and let you know about other things, and you can share with the public. Thank you all very much.
Thank you.
Mm-hmm.
Bye-bye.
Thank you all very much. Bye-bye.
Bye-bye now.
Have a good one.
Dr. Smith, how you doing?
Good.
Fantastic.
I'm good. Good seeing you.
Good seeing you too.
All right.
So do we need to leave or just go into another session?
Yeah, you can leave whenever you're ready. In essence, too, the next session doesn't really start until like 12:45, and because of the technology things, you know how this works. But you're welcome to leave and go into the various expos and things of that nature if you wish. And again, thank you guys so much. And you know how these challenges are with technology, right?
You know what? Now the share my screen thing comes up. I think it was related to what you were saying before, when it's a limited number of people on the screen. So then it didn't allow us to share the screen.
Well, we had 5. Technically, it's supposed to work with 5 on there, and I you know how it is. So.
Right. Well, just 3 of us.
Actually, Alex, we needed to increase the number of people because the screen takes up a window. So if it's if 5 people are in a session, there cannot be a 6th window, which is the presentation. So
really,
so that was the problem.
So
yeah. Because I just noticed this, I'm able to open
you
up
can see it
screen.
now. Yep, you can share it now, right?
Yeah, well,
I'll put your
see
presentation
for next year.
in the chat. Looks like a few people are still.
We'll have it together next year.
Well, we really thank you guys.
Year, yeah.
Yes, indeed. We thank you so much. Thank you so much.
Thank you for having us. And Dr. Smith, I'm going to call you on your cell. I think I got your cell.
Okay.
Okay. Let me make sure. I'm pretty sure.
And Dr. Johnson, we'll talk later. I'm gonna leave you guys right now.
All right, then. Thank you.
Thank you.
Appreciate the opportunity.
Appreciate you being here.
Yeah,
you can give it to him.
It ends in 0617, right?
0617, yes.
Yeah, I'm calling you right now.
Okay.
Outstanding.
Right.
Bye-bye, gentlemen. Thank you very much.
All right. Bye-bye.
Hello.
Hey, Carlos. How you doing, man?
Hey,